Namaste, I am Dr. Shalushubham Keni, head of the department, Physiotherapy department, Apollo Hospital, Navi, Mumbai. Today we will discuss about physiotherapy exercises in pregnant women. As we all know, exercise offers potential benefits to both maternal and fetus health. To have a healthy pregnancy, it is important to eat well, get enough water, and avoid things which is not safe for you and your baby. Maternal benefits from exercise during pregnancy includes improved cardiovascular function, reduce the risk of gestational diabetes, also improve strength and your lean muscle mass. Exercise also gives your body to meet your growing hormonal changes which includes in your body after pregnancy. It improves the maintain the good posture and also move your body with care. To have a healthy baby, healthy pregnancy, it's advisable to start with moderate exercises, which is also recommended by American College of Obs and Gynae. So moderate physical activity during pregnancy improves and maintain your muscle tone, your strength, your endurance. Exercise also protects against the complication which can occur post pregnancy, like back pain. Also it occurs during pregnancy if your posture is not correct. So it can reduce the complications, also the side effect of it. So you can go with the normal life, you can go with the normal pregnancy, painless pregnancy, and the intensity of the labor can also be reduced. So it also gives you a mental, emotional strength. Also, it will help you in good social well-being. So, how much you should exercise and what kind of activities you should do depend on your general health, your fitness level, and your usual activity prior to your pregnancy. At what time of the day you should do exercises, which exercise is good for you, is always good to consult with your doctor, your physiotherapist before starting with any exercises. Exercises can be of any type. It can start with low intensity exercises, the moderate intensity exercises. For pregnant women who are in the first trimester or the second trimester, can start with moderate intensity exercises, which is always good for them. Low intensity exercises can also be like walking. If you don't want to go with any strength high, if you don't have any treadmill, you don't want to go with a cycle. If you have any complication, you can just start with simple walking exercises at your home. Exercise should be start with a warm up. Should not always jump directly for the exercises to start with a high pace. So always do your warm up, which can be a breathing exercise, so simple breathing exercises like breathing in and out from the nose. Simple, not holding your breath in any exercise, which is not advisable during pregnancy for exercise during pregnancy. So never to hold the breath, just take a deep breath slowly and breathe out slowly. Start with the spot marching or just simple up and down of the legs movement or the hand movements. In sitting, you can start up with. It is not advisable to do the exercises in lying position. After your first supine lying position, straight leg on the back after your first trimester. So you can do the exercises in side lying position. Also, the time which you want to do exercises also depend on person to person. Some people feel very good doing exercise in the morning session. Some do after dinner, maybe in the night before sleeping. It always varies from person to person. So you can start exercises maybe after the morning when you just get up, have some breakfast. You can take a break of 1 hour, 2 hour. Then you can start with simple exercises and you can do your walking and all. If you have to do your moderate intensity exercises, you can contact your physiotherapist. They can schedule your timing and then you can start with the activity exercises. For that, you always have to do some breathing exercises, walking, and then you can start with the strength training also, which will help you to maintain your muscle strength, endurance. Also the pelvic floor stretches so that you can hold your baby very potentially and hold your baby very tightly, so that it helps you to do delivery of the baby very easily with less pain, and also avoid the complication which is going to come, complications, or you can say the maybe you can say the effects post pregnancy, postpartum exercises we say it. So you can use the strength exercises which you are doing during your pregnancy, which can help you post delivery. So you also have to consider the posture after the pregnancy, during your pregnancy, how you are taking your own body. Like when you come into your third trimester, the baby, the stomach load, the baby weight increases, your own weight increases. So how you have to lean forward, how you have to sit with always with back support. You don't have to bend suddenly just to prevent the back pain. All these things have to consider. You don't have to stand for a long time, as there may be swelling in the legs, there may be cramps in the legs. So all these things needs to be considered. If you're sitting for long hours, like you're a working woman, you're sitting for long hours, so just try to take frequent breaks in between. Just try to get up, walk for 2 minutes, and then again you can take a position. So all these things can prevent the pain which you're going to get after doing the long posture things. As you want to work for long, if you're working in kitchen, so you can change your legs, like you will put a steps or a side on your other side of the, you can other side of the leg, so you can step up on one side and then you can change your legs position. You can sit for a while, keep a movable chair in your kitchen so that you can sit for a while and then you can stand up. Like these small things you need to consider, you need to take in your mind, so that you can avoid the things which will give you pain or which is not good for your health and for your baby. So after pregnancy also, you can just when you're feeding your baby, what the posture you should include. Your back should be straight, your baby should be supported while feeding. While holding your baby, you should not bend with your back. So all these small things you need to consider. So during pregnancy, you can start exercise after. I will suggest you can exercise after 5th month of pregnancy. It is advisable to start with exercises if you're not at all exercising before. So you can start with a simple warm up and the walking exercises, and the basic core strengthening exercises, back strengthening exercises on bed and then sitting. Then there comes the pelvic floor exercises, strength training with dumbbells, with weights you can start with. On ball we can start with the exercises. There are exercises when you come in 3rd trimester. There are exercises which can help you to reduce the labor pain. So during the 3rd trimester, when you come on, the exercises mainly focuses on to ease the labor pain. So that exercises also do in consultation with the physiotherapist. In Apollo Hospital Physiotherapy Department, we have running prenatal classes in which we guide the patients during the first trimester, 2nd and 3rd, how to go with the exercises, how to do exercises at their home. Also, when they come in 3rd trimester, how to do exercises during labor period, how to ease of the delivery of the baby. So you can take guidance from them anywhere. You need to start with exercises. There was a misconception before in previous days, in previous years, that women had to reduce the exercises as to get minimal rest. But now, since 2002-2029, American College of Obstetrics Keni have produced the evidences. We have evidences that we should do exercises. You should keep ourselves active as much as possible during the pregnancy, so that it will be good for a baby, good for the mother during the pregnancy, also after pregnancy. Thank you.